Ever walked into your clinical placement and thought, surely this ain't legal? Yeah, same. Welcome back to the mental health nursing vlog, where we expose the fine print on nursing student experience. You know, the real syllabus that don't print off on Moodle. Today, the clinical placement chaos your textbooks didn't prepare you for. Grab a snack, a stethoscope, and maybe a stress ball, because we're unpacking the good, the bad, and the what on earth is that smell? If you're training to be a mental health nurse, you already know it's not just about following guidelines, it's about knowing how to apply them in real patient care. That's why I put together the top 10 must-have skills for mental health nursing, a detailed, real-world guide that breaks down the most important skills so you can actually use them with confidence in practice. Inside you'll get breakdowns of key skills like de-escalation, crisis management, and therapeutic communication. Case studies showing how to handle real patient situations, practical strategies for risk assessment, documentation, and professional boundaries. If you want to be a kind of nurse that patients feel safe and colleagues rely on, grab the full guide now, links in the description. You know how nursing school simulations always start with a cam mannequin and pre-printed vitals? Cute, right? Yeah. Welcome to placement, where real patients breathe, blink, and occasionally insult your haircut. You arrive in full Florence Nightingale mode until your first task is handling bodily fluids before your second cup of coffee. No one warns you about the decibel level of a bed exit alarm, or how fast you can forget how to take a manual blood pressure the minute someone's actually watching. This is where the gap lives between I revised this and why is this happening? It's awkward, it's humbling, and it's happening in front of the entire staff team. Okay, one of my first placements, one of the first days there, one of the first patients actually. I introduced myself like I'm on The Apprentice, shall we say. I grab an OBS machine and boom, knock an entire tray of wound dressing straight onto the floor. The patient looked at me like I were a badly written soap character. Honestly, I agreed in all fairness. But here's the gold. The nurse supervising me didn't roast me. She helped. She walked me through it, and that moment, well, that was the real learning. I didn't feel like a failure. I felt human. Nursing school covers theory, but no one gives you a handout on what to do when a patient asks, "Am I dying?" Or when someone cries because they're scared. They don't prep you for emotionally navigating end-of-life care when you're still figuring out where the sharps bin is. They don't teach you how to clock your own panic response, or how to ground yourself when someone has a seizure for the first time and you're the one in the room. These moments shape you. They're not about getting it right, they're about showing up with a heart. Let's get tactical. Here's how I survived clinicals without moving into the supply cupboard. Well, permanently anyway. Number 1, ask early, ask often. Seriously, no one expects you to know everything. Preceptors prefer questions over cover-ups. Pretending to know what a nebulizer protocol is doesn't make you clever, it makes you dangerous. Number 2, write everything down. Trust me, your memory will betray you. Keep a pocket notebook. Mine had ob rangers, policy reminders, and that one nurse's coffee order because bonding matters. Number 3, eat, drink, sit. You're not helpful if you're fainting. You can't pour from an empty jug or care from an empty stomach. Number 4, debrief, laugh, rant. One placement friend is worth 10 late night spirals. You need someone to message, "Did I hallucinate the fact that a patient just licked the blood pressure cuff?" Clinical placement cracked me open more than any textbook could. It made me question everything, and then made me realise what kind of nurse I want to be. Because in those moments after the shift, when your feet are aching and you're replaying that one awkward conversation in your head, you realise this isn't just about becoming a nurse. It's about becoming your nurse. The version of you who can handle real life. Right, here's your post-shift tea break review. Clinicals are messy, unpredictable, and deeply human. You'll forget things. You'll spill things. You will panic. That's how it works. Support is your cheat code. Ask. Debrief. Don't isolate. This isn't a solo mission. You're not behind, you're becoming. There's no speedrun to competence, just day by day confidence. Also, bring snacks. Trust me. If no one said it to you yet, let me be the first. You're not behind, you're learning, you are growing, and placement isn't about being perfect. It's about showing up when it's hard and caring anyway. Drop your most chaotic, weirdest, or most human placement moment in the comments. Let's make this a space where student nurses can breathe or laugh through growing pains. And if you want to keep the series going and caffeinated, hit the buy me a coffee link because Tired Jacks doesn't hit deadlines. Still breathing after all that chaos? Gold star for you. Legend. Catch the full mental health vlog series here on the left. If you need more placement, reality checks, rants and laughs, it's like student nurse survival kit in video form. Need something a bit more self-care and less clinical chaos? My Matters playlist on the right is all about emotional strength, mental well-being, and learning to deal with your brain before your brain deals with you. Subscribe in the middle and let's keep learning, laughing, and surviving this nursing journey together.